It's a lovely day, a lovely morning, and for us in the studio, we're particularly happy because today we'll be talking about you and I. What do I mean? It is our health. That's the first thing. When you have found yourself alive, because I say found because you don't know how you came to be, it is all God Almighty. The next thing is for us to make sure that we enjoy the life. We give it value. We make it meaningful by making sure that we are healthy at all times. A lot of times our health is actually in our hands, so it is important that we make sure that we get to do all that we can to add value to that health. Today we will be focusing on cancer. Yes, it is region. The world population at one point is said to be depleted by lots and lots of cancers in the society. What are they? How do we curb them? How do we prevent them? How do we, if we happen to get in contact with it, mitigate against the ultimate result, which is death, or even ameliorate the pain it can bring? That will be our thrust for today. All right, we can deal today. Like I said when I started, we'll be talking all about you and I and ensuring that we keep ourselves on our A game with regards to our health. Now, cancer is one thing that has been, given a lot of definitions, but up until today, we really don't know what exactly causes it. We don't even know how to cure it. But one thing stands out: we should know how to mitigate against, getting it within our system by what we do and our lifestyle generally. Now, today we'll be looking at all of that, and a guest will be joining me shortly, but that will be when we have visited with Francis and see what he's cooked up to put us in the right mood for today.
For Nigeria and Africa in general, cancer is becoming most common and more deadly, with over 200,000 cases per year. Worldwide, cancer deaths are more than the percentage of death caused by HIV and AIDS, tuberculosis and malaria. It is the second leading cause of death in developed countries and is among the three leading causes of death for adults in developing countries.
Cancer is defined as a growth of cells that is purposeless, useless, debilitating, and causing loss of function to the body. And this cancer can occur in any age group. It doesn't not age specific. It can occur in a child that is in the womb. It can occur in a child that's 1 year. It can occur in adult. It can occur in any male or female.
According to Dr. Arua, not all cancers are hereditary. 80 to 85% of cancers are spontaneous. However, 10 to 15% of cancers can be hereditary.
Currently, Nigeria has about incidence rate of 125,000 cases every year and mortality of about 80,000 yearly.
There are more than 100 types of cancer, usually named for the organs or tissue where the cancers form. However, cancers that are most common in men include lung cancer, prostate cancer, colorectal cancer, stomach cancer, and liver cancer, while cancers common among women are breast and cervical cancers. While some symptoms may differ between people, it is important to get medications as soon as you notice the symptoms.
Like a woman who suddenly notices a discharge from the breast, or breast pain, or a lump in the breast, should know that there's a change and have to run to the doctor. And a man who suddenly starts seeing he goes out in the night to go and urinate about 4 to 5 times, Then sometimes he cannot hold his urine. So all these things are signs that something is going amiss in your system.
The reason for the growth in cancer rates in Nigeria and the extremely poor countries are varied, such as increasing exposure to cancer risk factors, which include unhealthy lifestyle and environmental pollution, late diagnosis and poor access to health care.
Like those who smoke and who drink a lot of alcohol, they are prone to developing a lung cancer, they are prone to developing gastrointestinal cancer, like cancer of the stomach, cancer of the throat, cancer of the voice box, cancer of the kidney.
The psychological effect of having a cancer can be devastating, and perhaps the key issue is that most people simply cannot afford the high cost of cancer treatment, be it radiotherapy, chemotherapy, immunotherapy, or surgery. According to Dr. Arua, it is not every cancer case that requires radiotherapy. Also, the cost for curative treatment is 600,000 naira, while that of supportive treatment or palliative treatment goes for 350,000 naira.
The good news is that NHIS, that National Health Insurance, can take care of this. And recently, Nigeria launched what we call Cancer Health Fund, whereby indigent patients can equally access this kind of treatment without paying out of their pocket.
Today on Weekend Day, our focus will be on cancer and all you need to know about cancer. Weekend Deal!
All right, so Weekend Deal will be, I told you, having a discussion with my guest here with me. She came all the way from Maiduguri, and I was just asking how Maiduguri is. She said, lovely, lovely place, and she actually radiates it. So this is Dr. Hadiza Usman. Thank you for coming with us.
It's a pleasure to be here.
All right, so Doctor, I would like to know really, just before we came in, we said something that cancer is one thing that is so confusing. I would like to know what is new about cancer. But before you answer that question, I'd like to pay a courtesy call, virtually speaking with IJ and get to find out what she has for us.
There are several cancer diseases that affect the human body, but with emphasis are those predominantly affecting women of all age and race.
If we want to look at the cancers that are specifically related to women, then we have breast cancer, cervical cancer, ovarian cancer, thyroid cancer, but more or less any cancer can actually occur in a woman, except for things like prostate cancer, because the woman doesn't have a prostate.
But there is a sixth one, a very rare type, and that is the fallopian tube cancer. However, these cancers come with varied symptoms in a woman's body.
The most common symptom that you find in breast cancer is actually a lump, usually a painless lump in the breast that increases in size as time goes on. But of course, you have other symptoms like nipple discharge. When you have abnormal nipple discharge that is bloody or the color is altered, then it calls for concern. Of course, you can also have things like nipple deviation, and you can have even wounds. You can have a sore. Then there can also be a lump in the armpits. For cervical cancer, the woman can present with vaginal bleeding, vaginal discharge. Usually this differs from the normal vaginal bleeding of menstruation. So it can be in women that have stopped menstruating and then suddenly they start seeing blood. It's not normal. And then there can be discharge also. We know that there's a normal vaginal discharge, but for this one it is usually very plenty. It's described as copious, usually very plenty. It's also foul smelling. For thyroid, the thyroid is an organ that is seen in the neck, so usually there will be an anterior neck swelling.
With these symptoms in mind, every woman, irrespective of your disposition, is advised to get regular checkups to either get early intervention or prevention of the disease.
The survival rate for any cancer depends on the stage at which the cancer is gotten. So when you catch it at a very early stage, and that's why screening is advocated, you can have complete cure. But when you get it at advanced stage, then the survival rate goes down as the stage increases.
As you know, many women are concerned about their reproductive health.
When you're talking of the statistics for breast cancer, usually it's commonly found in women, postmenopausal women. That's women that have stopped menstruating. But of course, now we're seeing it in younger women, in women that are still even menstruating, in women in their reproductive age. Commonest age group is between the ages of 45 to 55, which is actually like a decade lower than what you see in the advanced country, where theirs start from about 55 to 65.
And so, more awareness are needed, especially in rural communities where access to health interventions and facilities are scarce.
I would not say you find oncologists in rural areas. You find them in most of the teaching hospitals and the big tertiary hospitals. And so if a woman presents in whatever hospital she uses, even if it is not available there, she can be directed to where she can have it. As per subsidy and all that, I know that there are a lot of non-governmental organizations that sponsor these things and, you know, give free screening periodically, especially when you mark the World Cancer Day or when you mark Breast Cancer Month in October.
So, now you know. Always check out for these irregular growths on your body or changes in your body system. You may be fighting the disease head on.
I always love to smile, but I'm not going to let this take it away from me. When you mentioned cancer facts for women, listening to that, I got deep in thoughts. But the good thing is the doctor I earlier introduced is seated here with me, but now she's about to lend her voice to this beautiful topic. I'll make good your introduction. She is Professor Hadiza Osman Abdullahi. She is also the professor of gynecology, oncology at the University Teaching Hospital, Maiduguri, and very importantly, she is also the Secretary General of the Nigerian Cancer Society. Thank you for joining us.
It's a pleasure.
All right. Now, I asked a question.
Yes.
Where are we with cancer today?
Yes. Let me start on a sad note.
Sad note?
Yes, that the statistics is actually on the increase. On the increase in the sense that probably there's more awareness, but most importantly, I think our lifestyle is changing. In the sense that what we're used to in the past is not what we are used to now. A lot of people are going into other Western lifestyle. Like, let me cite an example of breast cancer. Ordinarily, we are not known to have very large statistics when it comes to breast cancer. But of recent, there's a lot of change because there are certain values, certain nutritional facts that we are known for that are protective, like breastfeeding. That we normally
Breastfeeding?
do, that is supposed to be protective.
Oh.
But now most women don't breastfeed.
Oh.
So that on its own is adding to the burden of disease. But most importantly, like I mentioned, our values that we're losing, our lifestyle that is changing and it's becoming more Western. And I'm actually just narrowing my discussion to this region for the want of time. So
No,
that
you
we
know,
focus.
you mentioned...
So in a region of 206 million, we're having almost 126,000 cancer cases in 2020. And sadly, out of that statistics, almost 79,000 mortality deaths from that cancer.
You know,
that is why I say I'm starting on the sad note.
I'm really
That
sad
the
because...
statistic is scaring.
yeah, because
But even
Nigeria
at
says
that-
that the breast cancer for the women is actually one of the top listed.
Apart from that, let me equally add that this is an underreport statistics.
On the report. So
On the
it's
report
actually
statistics.
heavier than what we
It
hear.
is, because these are cases that we see in our hospitals. These are cases that we get to register in our cancer registry. But how about those that are at home? You know the myth about certain swelling? Some people will get a lump and they will stay at home.
It's from our village people.
From our village. And we know that the population are actually rural. Most people are in the rural setting. They don't have access to health. So those people are actually lost from our regular statistics. So it's actually an underreported statistics. And that is why I'm saying that it's actually much, much larger than what we have currently. And
You know-
we that are
City.
in the city have equally adopted certain lifestyle that is actually making us prone to have
it.
cancer. I'm just citing breast cancer. Name it. Lung cancer, colorectal cancer, prostate cancer. a lot of this depend on certain things that we do that brings about these changes.
You know, let me go back on the breast cancer thing for several reasons. One of it being that it's highly reported, and you and I are women. Now, what you mentioned about breastfeeding, you know, a lot of ladies will tell you, I don't want to breastfeed because I don't want my breast to sag. So
low gravity will always have its effects. You breastfeed, you don't breastfeed, by the time you are getting to that age, the breast will sag.
It will point down.
To point down.
Okay.
And there are so many benefits of breastfeeding. One of which is the prevention from this breast cancer, which I just mentioned.
All right. Now, still on the breast cancer, we do a lot of things like the boob job to keep it standing, you know, keep it perky. Does it also have anything to do with breast cancer?
It has nothing to do with that. That has to do with the muscles around that area to firm the area. But the breast tissue itself, the fat that is supposed to the breast, has nothing to do with that. It's more of the pectoralis muscle that is actually pumping the breast and to make it stand. So when you do those exercises, it has no effect on your risk of having breast cancer at the end of the day. It's just to keep fit, strengthen the muscle, and then make the breast to stand. Okay. But it has nothing to do with
that's good to know. All right, so you mentioned series of breast cancer, cancers in the bodies. The point now is who is susceptible and how do we get it? You already mentioned something about lifestyle, but let's quickly join Magdalene to give us a little bit of a background on that particularly. Then we come back and talk.
Thank you.
In order to stay healthy, experts reveal that an individual, regardless of the age, must be aware of the benefits of eating the right food at the right time and in the right quantity.
When we say the right food, we mean balanced diet, carbohydrates, fat and protein in equal proportion, in such a way that you are not obese and you have extensive physical exercise. Sedentary life does cause obesity and by extension causing cancer. So if you are eating right, you are eating the normal diet, a lot of vegetables, a lot of fruits, and balanced protein, balanced carbohydrate, and balanced fat, then you are not likely to be obese, and as such, you will not likely develop cancer as a result of obesity.
Now more than ever before, what one eats is no longer just about what food an individual takes delight in. According to the World Health Organization, WHO, a total of 30 to 40% of the ailments existing today are as a result of the quantity and quality of food being consumed at different times.
People that already have cancer are being told not to take sugar because they've been told that sugar, cancer cells feed on sugar. Yes, it is true that cancer cells like sugar, but the brain cannot function without sugar. So if you don't have sugar in your body, you will just drop dead, because at every moment you must have some certain amount of sugar in your brain for you to function. And the body will produce sugar from other sources, even if you don't take sugar or you don't take carbohydrate. It will convert your muscles, your fat into sugar. So what that means is that the body actually needs sugar, and the cancer cells also need sugar. So if you are looking at it logically, it means that you should also take even more sugar than depriving yourself of sugar if you have cancer.
On the streets, it has been observed that food vendors prepare meals with additives. Sometimes they add artificial colors and sweeteners to meals to make it more attractive. This also happens with roasted meat, oftentimes grilled over open flames. How safe are these practices?
It's not only swear. Any food that is exposed is likely to be contaminated. And that is why we keep having issues of cholera and so on. Because what usually happens is you get some form of bacterial infections, some of fungal infection from those foods when they are really contaminated. But they don't predispose to cancer.
All over the world, including Nigeria, research shows that cancer has become more prevalent and deadly, with over 200,000 cases being recorded per year. In some cases, doctors say it is hereditary, while in other instances, it could be lifestyle. On this note, doctors and research experts advise that to live and to stay healthy, vegetables, fruits, and regular exercises should become the norm for everyone.
Smoking, sometimes I wonder, is it that we enjoy burning our inside? Is there a deep freezer inside that we need to keep?
Well, maybe those that smokes are in a better position to answer
To
that
answer
question.
that.
But let me add to that background that yes, the person that is smoking directly is affected, but the people that are with that person, let's say the spouse of a smoker, is 20 times more at risk. The smoke that the smoker is inhaling is a filtered one, but the one that is coming directly to the face of the person that is staying with him is more hazardous, has 20 times higher risk of developing whatever problem that individual is likely to develop. Apart from smoking, let me put it to us that most of us here are smokers, indirectly, in the sense that when we go out in the morning, those exhaust fumes that is coming from those unchecked, unmotorable cars that are not supposed to ply our routes, that are supposed to be not roadworthy, are responsible for most of the health issues that we're having. Apart from chronic respiratory problems, they end up putting us at risk of developing most of these cancers, especially lung cancer. So you can see, yes, the statistics is just looking at the smokers, but indirectly, almost everybody is at risk.
You know, because at the end of the day,
friend that smokes, or you are always the mechanics that are in the workshop that are exposed to these fumes.
From the generating
set,
if you go to a place like UTC and there's
yes, in your car, whether you
power supply everywhere,
no matter
apart from
how
the noise,
you try to minimize it, put on your AC, some of it will still find their way into your
you
car.
actually do have a point, because there was a time there was no lights. Everybody around my neighborhood, you know, powered their generating set. I actually live upstairs, and mine wasn't on. But because the windows were open, I was almost choking. My eyes were red, even though I was sleeping. So at the end of the day, I could not sleep. I had to wake up.
A lot of those toxins.
Exactly. So it actually goes a long way to tell us.
There's a lot that we need to do if we are talking of preventing cancer. Really, we have to. Those that are responsible have to do a lot about it. Any car that is not roadworthy should be removed from the.
Should be removed. Okay.
But a car is discharging very dark fumes, and a lot of people are there and nobody is saying anything. And these are things that I...
Even the stop and search people should make sure such cars are off the road.
Yes.
All right, so moving away from the smoking parts, the food angle too, it was mentioned. Sometimes, like I said when I opened, that sometimes medically speaking, I get confused. You've been told a little bit of alcohol is good for your system. Now they are telling me alcohol is bad for me. Where do I, which line do I fall in?
Cut-off line between a little alcohol. Alcohol generally is not too good for your system, because the problem with alcohol is that ability for you to indulge. You don't have a limit. Before you know it, you are crossing the boundaries, and your system will react to that in terms of developing some of these cancers that were mentioned. So what I would advise as an individual is, in the first place, if you can avoid taking alcohol, please do, especially for the women.
Okay.
There are a lot of problems with alcohol, from pregnancy-related problems, and of course, the cancers that we're discussing.
All right, so, okay, go ahead.
You asked about dietary
food.
What I want to mention specifically is we are leaving our natural food. We are eating more processed food now. We are eating more fried food. We are living sedentary lives. We are not exercising, and we are adding weight. Quickly, because I'm a gynecologist, let me add that when you get to menopausal stage, you are more at risk of developing cancer, because there are certain hormones that do protect you during those reproductive age.
The estrogen.
The estrogen.
Okay.
So you're likely to develop more because you're likely to live a sedentary life, you're likely to be more obese, you're likely to have more excess fat, which is going to be converted to estrogen.
That's actually when we are the real madam, so that's when we
Yes.
use house help a whole lot.
Yes.
When we should actually be doing the job ourselves.
You're not exercising. So the age-related damage to your cells is further compounded by those sedentary lives and the excess weight that you are adding to your system. And the risk of developing the breast cancer, endometrial cancer increase at that age. So I'll use this opportunity to advise that yes, as you are getting to those 50s and 60s, please be more active no matter how little it is. Don't just let yourself add excess weight so that you don't develop some of these problems.
All right, so earlier on you started by talking about predisposed factors and people who are predisposed as well. And the earlier feature made mention of some of them. What could make me, say, okay, I should be more careful than my friends or my...
more biased towards female cancers.
Okay.
Number one being breast cancer. 1 in 8 cases of breast cancer are genetic.
Genetic.
If you know that you have a family history of breast cancer, the ideal thing is at a certain stage, because you are likely to even develop the breast cancer 10 years much more earlier than when that relative had that breast cancer. You're supposed to start looking into all those signs and symptoms. And let me quickly add that most of these cancers are very painless.
Painless.
So you have a lump in the breast that is painless. Don't just wait until it is painful before you start looking for experts. Go out there and have a proper check on the breast. And like we kept on advising that women should always examine their breast at least once in a month. And if there's any lump that is not supposed to be there in the first place, they should seek for an expert advice.
This breast examination is very confusing.
It's not confusing. The good thing is there are so many apps there that you can use.
Oh, okay.
So if we don't even have, I'll just advise that there are so many breast examination app that you can just download and very easy. The most important thing is to have it regularly, at least once in a month. And for cervical cancer too, let me quickly add that this is the only cancer that you can prevent. You can preempt and you can prevent it.
Okay.
If you must have one cancer, let's assume that it is your portion that you must have one cancer. Yes, I'm not speaking to you. Cervical cancer, you can actually preempt what will happen in the next 10 to 15 years. It is preventable. And how do you prevent it? Just by keeping an appointment with your gynecologist at least once in 3 years to have what we call pap smear. But the good thing is it's equally vaccine preventable. We have the HPV vaccine now that can be given to women before they start their sexual debut.
And people can actually do it as early as 16 years ahead?
In fact, as early as 11 years.
Oh, that's
And it
good.
has been expanded to 26 years for those that have not had the opportunity to have the vaccine.
Okay.
So you can actually be vaccinated.
Okay.
For those
That's
that
good.
miss the opportunity, then they can have the pap smear.
Okay, that's good. Some people are writing in asking questions. I'll have to hurry up to ensure that we carry everybody along. Someone says, in addition to all, sometimes some certain cosmetics can really cause cancer, especially when it reacts with the sun and does not go in line. How does that work?
Yes, some of the cosmetics, especially the ones that are being brought to Africa, are actually made up of cheaper
Wow.
cancer-causing agents. So please, I think, especially those bleaching agents should be avoided.
Okay. Now, if one has, contracted this already, what are the, prescribed lifestyle one can do? Because a lot of times we're asked, do regular exercise, do this, do that. For breast cancer, if we notice anything, what is the first point of call?
The first point of call is to go to the hospital.
Okay.
And then from there, to be properly examined, the right investigation will be done. If there is need for a biopsy, which will confirm whatever it is, and then the right treatment will be taken. And like you had on the background, the most important thing is early presentation. Once you present early, the disease will be able to nip it in the bud and prevent the progression. But sadly, almost 70 to 80% of almost all the cancers. Both the breast cancer, cervical cancer present at the latest, or I mean the late stage of the disease, where virtually we can do nothing. You see a lump, you ask a woman, how long have you been staying with this lump? She will tell you she has been staying with it for the past 2-3 years. Until everything has erupted and is fungating, is smelling. She cannot actually control that swelling and pain. Then she presents herself to the hospital. Equally, for cervical cancer, a woman will be having, most of the times, there's no early symptoms. If you are waiting for an early sign, you may never get it. And that is why that screening is very
Regular
important.
checkup.
But by the time you're already having those discharge, those smelly discharge, those bleeding when you have sexual intercourse, those very uncomfortable pain in the lower abdomen, it's just heralded that that disease has advanced. And by the time you present, you had the cost of radiotherapy. And how many radiotherapy machines are functioning currently now in the country? The cost has gone up to 1 to 1.5 million for you to have a complete session of radiotherapy.
Wow.
And these are diseases sometimes that are actually with those of low socioeconomic class. They cannot afford it.
You
and
know,
that is why our mortality rate for cancers in this region is very high. Because
I refuse to be low spirited as much as it's setting in. The more you talk, the more I feel
we
it.
have to say the truth so that people are aware of it. Awareness is what we're trying to generate. Once you're aware of it, you know that it can be prevented, and this is what it is. You don't stay at home.
Okay, so let's pay some bills. When we come back, a lot more, and I see plenty people writing and asking questions. I'll try to take as much as I can, but for now, let's take a break. It's still Weekend Deal as you have Professor Hadiza with me here. I said that a lot of people are asking questions. All right, somebody wants a clarification on what you said about the cancer, cervical cancer, and it wants to know how often we should take it and who can take it.
Is that the vaccine or the pap
The
smear?
vaccine.
Vaccine is available for ages between 9 to 16, and now it has even been extended to cover for those that are up to 26, as long as they are not already sensitized. Sensitized in the sense that they are not sexually exposed, and then the high-risk virus, that is the human papilloma virus that is responsible for that cancer, is not she's negative for that, because that is one key factor when it comes to vaccination. And then the pap smear should be at least once in every 3 years.
Okay, once in every 3 years.
Yes.
That's good to
If
know.
it's negative.
All right, so another one is asking the particular, do you have an app? You said the app, if I just type in breast cancer,
just type
breast cancer app.
breast self-examination.
Okay, and the app will pop up.
Yes.
Now, it's not all about breast cancer. There are other cancers. One of them we earlier saw on report. It says the cancer for the men. That's the prostate. And I recall when the symptoms was going on, there was a bit of argument here. Somebody said, that's diabetes. And he said, no, it can also present. How do I begin?
The confusion between a prostate cancer and a benign, because at certain age, especially as men are aging from the age of 45, 50 especially, to 60, there's what we call the prostate gland that is just at the neck of the urinary tract, and especially the bladder. That prostate gland starts to enlarge.
Okay.
And that enlargement constricts the urinary outlet and makes you to go to pass urine frequently. Because anytime you go to pass urine, the volume of urine that you are able to pass is reduced. So that will make you to be waking up in the night to pass urine frequently. But you cannot really differentiate between that symptom and
Symptoms of diabetes.
Of diabetes, because both of them actually gives you that nocturnal urination. Frequent urination in the night. So the only thing is to go and have a checkup whenever you are having such symptoms, both for the diabetes, but most importantly, to have the prostate check. And then the urologist will be able to differentiate between just a benign swelling of that prostate or this potential malignant transformation of that.
Okay, now this prostate cancer again, is it hereditary? I mean,
Yes,
if my father had it...
Prostate cancer is actually hereditary to some extent. There's genetic component to it.
Okay.
So if there's a family history, especially immediate family history, first degree family relative, put it at the back of your mind to always to start earlier. What I'm trying to
check.
stress,
When you say earlier, what time, what year?
Both breast, ovarian, prostate cancer that are genetical, that have family inclination, family history. What we normally advise is if you have a relative that died or had the disease, let's say at the age of 50, you should start looking out for it at the age of 35, 40, 10 to 15 years.
You have to really go backward.
Yes,
okay.
so that you'll be able to track it.
Someone mentioned about fibroid as well, that when you're in the reproductive age and the womb is vacant.
All this has to do with your hormone.
Okay.
It has to do with your hormone. Both the fibroid, the breast cancer, the endometrial cancer has to do with that estrogen. So that is why some of these things, once there's no balance of that hormone, you tend to have one of those cancers or benign cells such as the uterine fibroid in such women.
All right. I know that you're also someone who is, high up in the management of cancer in terms of the Cancer Society as the Secretary General. We'll be coming back to you, but I want to quickly take us to JOS to go look at Cancer Care Fund, Equipment and Survival. That is from TV, JOS Television and NTA JOS, sorry. When we come back, we'll take more questions around that as well.
An emerging disease in the developing world owing to the control of infectious agents and increased longevity.
Globally, cervical cancer ranks the fourth most common cancer after breast cancers, colorectal, and the lungs cancer. 10 years ago, Nigeria recorded 11,500 number of new cervical cancer cases. Out of this number, 6,000 died within 1 year.
In Plateau State, the Jos University Teaching Hospital has in the recent past initiated various cancer screening projects, diagnostic and treatment equipment, and has benefited same from international collaborative grants focusing on cancer.
The grant was to purchase a state-of-the-art machine that has components that can be viewed on the cloud. So we store data on the cloud. It was the grant that helped us open the Cervical Cancer Prevention Center in the HIV section of it at the Old Jute. From 2019 to date, we have over 10,000 cancer patients.
Cancer treatment is a huge burden for the patients, caregivers, and families.
I must do some tests before I come for the chemotherapy. That will amount to almost 90,000. When you calculate it, 6 courses. I'm feeling better now, more than before. I'm more stronger than before because I can do anything that I want to do.
The health insurance scheme does not cover cancer treatment for workers.
Well, formerly, when this scheme started, cancer patients were not covered. But at the moment, cancer enrollees can be covered because there is an agreement between the Roche company and NHIA to take care of cancer patients. There is a discussion. Very soon the matter will be known to the public.
Cancer management is bewildered by numerous challenges such as poverty, illiteracy, lack of governmental will in implementing viable cancer prevention policies and programs, inadequate cancer screening and treatment facilities, and late presentation by cancer patients.
We are very hardworking and passionate people, and we are ready to assist. If we have the funds, we are really ready to do a lot of things.
Just hearing that a person has cancer can be frightening, but knowing what to expect from diagnosis to recovery can empower and help people take control of their health. Health is wealth. Take good care of yourself.
All right, cancer is one ailment that we just cannot still fathom how not to get it within our body. It does not have respect for age, it does not have respect for color, it does not have respect for status, whatever it is. But then whenever you get it, whether you're a poor person or a big person, it cuts right down to your pocket. If you're a man, it's not your front pocket, it's the back pocket. That's where we pack the bigger notes. But I'd like to go back to the professor. Prof, please, where are we in terms of cancer management here in Nigeria, funds-wise?
Yes, like you did mention, cancer treatment is very expensive wherever you are, and most NHIs do not support that. But I would like to commend the federal government with the currently launched National Cancer Fund. Indigent patients do have access, though it's just limited to 6 pilot centers in the 6 geopolitical zone. Patients are being scrutinized. Those that are deemed to have access to that fund are actually being given that care through that fund. We, as Oliver's Twist, we are always asking for more, because really, if you look at anywhere globally, even the developed country, cancer management is very expensive. But one of the, apart, like, cancer treatment is not just about giving drugs. One biggest issue that we are equally bedeviled with in this country is the availability of radiotherapy centers. At a moment, I can boast of 10 to 15 10 that are functional,
that means it's not even
including private sectors. And ideally, for every million population, there should be one radiotherapy center. And we are talking of a population of over 2 million. So we should be talking for at least 200 radiotherapy centers in this country. We commend the federal government. They are looking into it. My teaching hospital has equally just built a very beautiful radiotherapy center that is very soon going to be commissioned. But we need more and more of such. As a gynae oncologist patient, my greatest pain is when I refer a patient to either Zaria or Abuja, an indigent patient, and the patient will be looking right on my face, telling me that I cannot afford to go. The first problem is even moving from that center to a new place entirely, and then the cost implication. So cost-wise, we need to do a lot. The fund is there, but it's just limited to certain centers and certain group of people. We hope that very soon it will be able to cover a lot more people. This is what Nigeria Cancer Society has fought for, in addition to other partners, to really see that this fund is properly disbursed and reimbursement of the fund. And we hope that the federal government is going to add more money to that fund and more people will have access. But it's not easy to treat cancer. It is very expensive. No matter how rich you are, it will drain the family income at the end of the day.
You're talking and panicking. But I will
not
not
panic.
give up.
The good thing is most of them are preventable. So
Yes.
we're always focusing on prevention.
All right, so let's look at one or two questions here. Somebody's asking us. He says, thank you, Professor. I'd like to know, what is the relationship within radiation and cancer? All right, that's on radiation. Before the professor lent her voice, let's go to Channel 10, NTA Channel 10 in Lagos, and find out what they have put together on radiation.
According to research, there are clear evidences that establish radiation as the cause of most common forms of cancer. One may wonder, where do these radiation come from?
We are really talking about ionizing radiation and also the radiation we get from sunlight. Okay, so from sunlight we are talking about ultraviolet rays, which is being implicated in cancer, particularly the skin cancer called melanoma and other non-melanoma skin cancers. All right, and for the ionizing radiations, we get that from X-rays, and we can get that from CT scans or to mammogram, especially when it comes to screening for breast cancer. So repeated exposure has been implicated in, the incidence of some breast cancers.
It has been speculated that telecom masts also emit some radiation which could be harmful to humans. For instance, Lagos State, the Commercial Nerve Center, houses a good number of telecom companies. This explains the presence of masts in every nook and cranny of the city. Some of these masts are seen in residential areas beside buildings, plus the citizens receive good compensation for the erection of masts within their locality. However, medical practitioners have debunked the assertion that the radiation from telecom masts may lead to cancer.
When we are talking in medicine, we have to be evidence-based. We have to do research, we have to correlate and be able to say from so year to so year, we've done this and this is what happens. Now, for telecom masts, what they deal with are radio waves. Radio waves is also what we use on our phones, okay? Is what the TV network use, like NTA and everybody's radio waves. And they are non-ionizing radiations. That means is that they cannot disturb the cell, the atom of the cell, and cause to knock off electron. They've not been shown to cause damage in the DNA of the cells. And so if you can't cause damage in DNA of the cell, according to science and pathology, they can cause cancer. Okay, so until we are able to link that, number of people that have, masts in their compounds, follow them for 5 years or for 10 years, they develop a particular cancer. And people that don't have masts don't have that kind of cancers. We can't generalize that. It's just speculation.
With over 200 types of cancer, which can occur in different tissue or organs of the body, symptoms may vary widely. Medical practitioners have continued to emphasize on the need to present a cancer case early, as there are various treatment options. It is pertinent to note that cancer is not a communicable disease, but early detection is key to recovery.
Okay, early detection remains key to almost about everything health and of course everything life as well. But going back to what we just heard, she said most of those things have not been found culprits, yet. But then, what's your take on that?
Yes, I agree with her. In the early age when we started using those big phones, those big Nokia 33, whatever, they tend to emit a lot of rays. And when they first came, most people were putting the phones on their pockets. So there were a lot of reports that some women were having breast cancers, okay, particularly in those areas that they put their phone. But the current phones, the new generation phones that we're having, don't really have that much radiation in terms of...
Even when you're charging it, or we should avoid...
Well, I don't really have the facts about that, but really they are really minimal.
Okay.
So there's nothing to fear about those ones.
All right. Please, doctor, when we have itching on the breast, can it be a sign of cancer? Because I'm experiencing itching of my breast sometimes.
There are so many causes of itching, especially when you're on the other size, plus size.
Plus size?
Yes.
Oh, okay.
The mammary folds, it's a lot of sweat. But when the itching becomes more persistent and there's a change in the skin, what I want us to observe when we go for those breast examination is to know what your normal breast is. When you see something that has just changed, like the skin of the breast just becoming like that of the back of an orange, what we refer to as pudurange, you should sound an alarm. And if that area starts to itch, you saw an area that is a bit edematous and it's looking like the back of an orange and it's itching, it may be
when
a
you
sign.
say back of an orange, it means it's dimpled and,
yes, dimpled
and
yes,
dry.
Dimpled, and you just see those dots on them. Please, and it's becoming more itchy. Please, don't stay with it at home. It could be an early sign of a change in that area. Go and see your doctor for a proper examination.
Okay.
But ordinarily, there are 1,001 causes of itching.
All right, I would like to also take this one. It says removal of the breasts. Is it the best treatment for breast cancer?
There are so many stages of the disease. Most of the times when the patient presents with either stage 3 or stage 4, there's nothing much that one can do. It's just what we call breast toileting. Just at least to remove those fungating, smelling mass so that you'll be able to administer some drugs and reduce the remaining cells and then prolong the life of the patient. So, but if a patient presents early and is just restricted to a particular area, that segment of the breast can be removed, or even chemotherapy can suffice most of the time. So it's not in all cases that we have to remove the breast.
That's nice. But if it's what you need to survive,
yes,
it doesn't. When you remove it, what does it mean for you?
Well, anyway, there are so many social issues, but there are implants, there are so many cosmetic things that you can use to still look beautiful and healthy.
All right, so what is the risk factor for cancer associated with people that bleach their skins? I don't know.
I think we discussed that bleaching
Okay.
has destroyed the natural immunity of the cells in that area, and of course a lot of mutation can take place. And mutation is the genesis of most of this cancer. That is changing from what is normal to what is abnormal.
Now, the conversation in my mind, I'm sure you guess, because all of us have the same thing, is why did the woman mention that she takes ogi, which I know is pap?
Ogi is more natural, but now we go for refined food. Most of the times we go for custard, which is more starchy.
And at least that one, I don't need lights to preserve it now.
Yeah, that is the problem. We go for more refined food. And I want to sound a serious one in here. That anything that is so sweet and tasty and so inviting, run away from it. Most vegetables, if you look at them, especially the salad, if you don't really put those creams, they don't look inviting, they don't taste nice. But the one that you take at their natural baseline taste have more nutritional value, have more use to your body than all those refined food. Like she mentioned, have a garden. You don't have to buy those expensive things. Our beautiful ugu can be grown in our garden. The spinach are there. In my northern region, jogole is there for the low social class, and everybody can afford to do that, to go for that. So you don't have to go for those expensive vegetables and fruits. There are natural fruits that are very common in the locality. Just eat what is in season. It is cost effective. It is healthier. I like how ogi.
Yes.
Go for ogi rather than
You know
custard.
what you're saying. I remember a pregnant woman who once told me that she carries special snacks, and I opened the bag one day. The snacks was a lot of cabbage, raw ones.
Yes,
she diced
she
them
diced
and put in a bag.
Especially for those of us that work in the office, you can just stock your fridge with tomatoes, cucumbers,
And be
snack
munching,
with
you
it
know,
rather than buying
chew
those.
cabbage rather than
Yeah.
chew biscuits and all of that. It's interesting to know. Do a lot of natural things. Somebody wants to know here: is there any difference between womb cancer and cervical cancer?
Yes, the uterus is divided into the uterus body proper, and then what we call the mouth of the uterus or the mouth of the womb, which is the cervix. So there's a cancer that is just restricted to the cervix, which is we call cervical cancer, and then there's an endometrial cancer, which is the lining of the uterus, where we normally menstruate from every month, and then the body of the uterus, the corpus, the cells of the body of the uterus can equally have cancer. Let me tell you us that there's no cell in our body that is living, that is having blood supply, that cannot become cancerous, except for our nails. We've never seen nail cancer.
Nail
The teeth,
cancer.
we've never seen
The
teeth cancer
artificial
because
one
they are
that
dead. These are dead cells, but
Oh,
any
okay.
living cell is prone to have cancer.
People that have loss of hair, is it not cancer too? All right, so
Some cells are dead cells.
all right, so good morning. Please help me ask your guest to throw more light on the renal cells carcinoma and possible solution to curing it.
Yeah, renal cell carcinoma is one of those cancers that are restricted to the renal means kidney. Okay, so it's like I mentioned, there's no cell in the body that cannot undergo cancer. So these cancers can be very aggressive, unfortunately, and they can present, most of the times you see a patient passing bloody urine and you just assume that it's natural. But by the time they are presenting, most of the times it's advanced. So the earlier time you present, the better for the outcome of that disease. So when you see changes in your urine, not the way you are used to, especially when you are seeing blood in your urine, don't just assume that it is normal. So go and see preferably a urologist, but any surgeon. At least you have a baseline to start evaluating you, and then from there probably they will look for specialists that will address that issue.
I know a whole lot has been said, but a lot of questions are all still coming in, and most of them are based on the fact that we must get our lifestyle right. Somebody says here that we should try to find out from OBJ Obasanjo what he's doing to stay so healthy, and I think I recall he said he likes his food fresh
He likes his
and
food
natural.
first, and he exercises.
So,
He's a
and
former
he does
military
a lot of
guy, a lot of
exercise.
exercise, so
So-
he's still very agile at this age. So maybe we should go and get his recipe.
We should also do the same. All right, your
the
final words.
recipe we missed is the military aspect of it.
Yes, yes. Sometimes over-drilling can also give you a bit of a problem. But on a final note, what is your message to Nigerians? Because we must live healthy.
Yes. The message to Nigerians is the myth and misconception about cancer. Cancer is very common. We are all at risk of cancer. Maybe let me just, I'm not trying to scare us, but I give us a fraction. That out of 200 million, about 78,000 new cases were diagnosed in 2020. So that means everybody's at risk, especially when there's a family risk. Let us stop this our not my portion syndrome. When you see something that is not right, shout. It's better to overshout than to keep. Don't hide your disease. When you hide your disease will hide you. For women, breast self-examination. When you see anything abnormal in your breast, please see your doctor. Have your pap smear regularly. Please, mothers that are listening to me, please immunize your daughters. Yes, we're trying to see that the federal government actually incorporates the HPV vaccine into the National Immunization Program. We hope we'll achieve it with the review that we're doing in the National Cancer Plan. We hope that we'll be able to achieve that. But for the meantime, it is cheaper to give them those vaccination as their first wedding gift.
Yes.
Because cervical cancer is actually a cancer that can affect any woman that has ever had sexual contact.
All right, the best gift for mothers to give to their children is good immunization, be it cervical or any other cancer. And that's coming from my guest this morning. She is Professor Hadiza Osman Abdullahi, Professor of Gyno-Oncology at the University Teaching Hospital in Maiduguri. And she's also the Secretary General of the Nigerian Cancer Society. Thank you for coming all the way.
It's my pleasure.
And I wish I could keep you here all day, but then it's not possible.
Time.
All right, the doctor stressed the fact that we need to always be on our feet at least once in a while, including being sure that you are eating the right thing, and of course ensuring that you avoid living sedentary lifestyle. The professor who spoke with us said it all. But the show continues tomorrow. My name again is Elizabeth, and it's my pleasure to be your host. Bye.